Today we are going to discuss about different sonographies performed during pregnancy. Myself, Dr. Chetan Madhav Khadke. I am consultant radiologist and head of the Radiology Department of Fortis Hiranandani Hospital, Vashi. The first scan which is done for the pregnancy is early pregnancy scan. In early pregnancy scan, the main objective is to see where is the pregnancy sac, the gestational sac, if it is in the uterus or it is outside. What we want to know is if the uterine sac is inside the uterus, the pregnancy can progress normally. But if it is at abnormal location, like outside the uterus, in the lower part of the uterus or in the cervix part, sometimes abdominal, that is called as ectopic pregnancy, and it's a complication which has its consequences. So once the early pregnancy scan is done, the fetal heartbeat and fetal development is seen or not, that is seen. If that is not seen in early pregnancy scan, this scan can be repeated after 2 weeks to see if the fetal development and heartbeat is seen. Once strong fetal heartbeat and good fetal growth is documented, then we can go for NT scan, which is a Nuchal Translucency scan. In Nuchal Translucency scan, two important things are seen along with the fetal development: Nuchal Translucency measurement and nasal bone. If these two things are there along with normal development of the baby, then common abnormalities, genetic abnormalities like Down syndrome, which is also called as Trisomy 21, then Trisomy 18 and Trisomy 13 can be ruled out. This NT scan's result is collaborated along with the double marker or triple marker test. Together one result comes which tells us the probability of having abnormality. If these values are within normal limits, the possibility or the probability of having any genetic abnormality in the baby, especially these 3 trisomies, reduces significantly. Once NT scan is done, next scan is anomaly scan, which is done around 20 weeks of the pregnancy. So in anomaly scan, we see in detail the development of the baby. The development of the fetus is seen from head to toe to the extent best possible. This is also the time when appropriate size of the baby is there and the fluid surrounding the baby is good enough to see organs of the baby, which can be seen clearly. After the anomaly scan, which is the most important scan of pregnancy, next scan is growth scan or Doppler. Based on the baby's development, a normal growth scan or along with normal growth scan, additionally Doppler can be done. Doppler is important to see the flow of the blood from mother to the uterus, then from uterus to the baby. So predominantly 3 arteries are seen: uterine arteries, the umbilical artery, and inside the baby's brain, middle cerebral artery. If the flows of these arteries are normal, then it is expected that the baby's growth is within normal limit, and along with that, if the growth parameters, the weight of the baby is normal, fluid surrounding the baby is normal, then the chances of proper good pregnancy outcome, delivery outcome is good. However, in case there is any abnormality in the weight of the baby or the blood flow to the baby is disturbed, then we can pick up through these growth scan and Doppler scan. Then appropriate management can be planned by the gynecologist, the obstetrician and gynecologist. So once the pregnancy comes near the term, based on the previous ultrasound findings and the growth of the baby, clinical findings of the gynecologist, obstetrician and gynecologist, the follow-up scan or the final scan can be planned, which is again growth scan or Doppler scan. So these are the important scans which are required in pregnancy. So I'll repeat once again. Early scan is done usually around 6 to 7 weeks. NT scan is done around 12 to 13 weeks. Anomaly scan around 20 weeks. Growth scan after generally 28 weeks. Once or twice it can be done along with Doppler. Thank you so much.